My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being www.GIPNOTHERAPY.com. Today we are going to discuss the signs and symptoms of depression. It is very pervasive in our society, and it is increasing. Depression not only comes in adults, but is noticed in children as well. And unfortunately, many children with depression suffer from childhood obesity and are on medication such as antidepressants. What are the signs and symptoms of depression? Depression does not become a mental illness if it is for a brief period of time, such as if the sufferer suffers some loss, a family friend, a parent, a pet. The depression is momentarily, for a short period of time. However, when the depression becomes prolonged, then it is called major depression. The other type is called bipolar depression. I'm going to discuss today more or less the signs and symptoms of depression. The hallmark of depression is extreme lassitude and fatigue, not wanting to get out of bed in the morning or do the activities of daily living, going to work, etc. Headaches also appear frequently, and migraine sufferers have 3 times the greater chance of developing depression than non-migraine sufferers. Chest pains, while we know that the heart and lung disease is important to rule out, but in the vast majority of those who suffer depression have unexplained chest pain. It also affects the gastrointestinal tract, and depression sufferers can complain of nausea, vomiting, loss of appetite or overeating, diarrhea and or constipation. There are also signs of anorexia and bulimia are related to depression, especially amongst females. General body aches and pains in the joints and the muscles of unexplained cause as a sign of depression. Chronic back pain causes depression, but depression can also cause chronic back pain. So one sees there is a vast variety of signs and symptoms that can affect those with depression. Some of the symptoms also, if they're ongoing, cause depression. So what do we do as far as treatment is concerned? Initially, counseling is important. Exercise, cardiovascular exercise is extremely important, as various types of chemicals are secreted in the brain, which in of itself do not treat the depression, but do make the depression lighter. Then there's the whole gamut of antidepressant medication, oftentimes associated with many side effects that attach to them, and patients stop taking them. We also find that people who are depressed tend to abuse drugs and alcohol, hoping to find some relief in those substances. Psychotherapy helps, as does medical hypnosis and guided visualization, because especially with medical hypnosis, one can tap into the subconscious mind, which general regular counseling cannot. My name is Dr. Hillel Mazansky, and I thank you for listening to this video.